Multiple myeloma patients can be very heterogeneous actually, and in most cases outside clinical trials, unfortunately one size does not fit all. And when one would like to handle these patients and consider transplantation, there are situations where sometimes things may prove to be quite difficult. There are several scenarios. It would be impossible to highlight all of these situations. For example, more and more transplant is being considered in older patients. And this can be like difficult situation, especially when considering an older patient with a comorbidity. Let's say, for example, a myeloma patient, 70 years old, with a history of whatever diabetes, let's say, but which is stabilized, having standard risk cytogenetics myeloma, and you would like to consider transplant. So these are like the delicate situations. Obviously, in cases of more aggressive situations, for example, plasma cell leukemia is a very high-risk situation where transplant is definitely needed, but we know that these patients are usually more fragile and the presentation is quite aggressive. So this is another situation where I would consider this is a hard to treat patient. There are many other situations, for example, performing transplant in patient with kidney failure or in patient undergoing dialysis. This can be also quite difficult. We know that there is no universal consensus whether you should or not propose transplant for patient under dialysis. However, there is data available showing that this is feasible and can be beneficial. Other situations where we know transplant may be useful but can be difficult to perform. Those patients with extramedullary disease. In extramedullary disease situations, we know that conventional chemotherapy and obviously high-dose chemotherapy can be extremely useful. But these patients are usually quite difficult to manage and to handle.